Hello, I'm Dr. Jill Westfall with SpinalWorks, and today I wanted to talk to you about some different spinal conditions that you may have heard of, but didn't know exactly what they were. I'm going to start off with normal. What's normal in your spine is when you have these nice thick bones with a nice thick disc right in between, and you have both of those bones and that disc that create a nice hole in the back, and that's where your nerves come out. You get a lot of nerve pain when that area starts to get pressed on, is what happens when you start to get a degenerative disc. Degenerative discs happen when you start to get arthritic change or arthritis in the back. And sometimes you can even get some of this area inside here you can see is not smooth anymore, which happens with degeneration as well. And when it starts to get a little bit worse, it starts to look like this. You can see that you have no longer these smooth borders, and you also have very thin discs. When you get that thinning of the disc, it closes off that area where the nerve is coming out, and the nerve can sometimes get pinched. And that pinching on the nerve creates pain that can sometimes go up into the head and create headaches. It can go down into your arms and create pain in your arms, hands, and fingers, and also pain that comes from the low back down into the legs, feet, and toes. More importantly, I think what people come into me very, very frequently with is called a bulging disc. So you have this normal disc that has these circular fibers, very, very strong radial fibers around them, like a radial tire, with a little bit of jelly in the center. And sometimes that jelly-like material can push out against those fibers and create what's called a bulging disc. That disc is still contained, there's no tearing there, but it can push against the nerve and create quite a bit of pain in the back and even a radiation at times. The herniated disc, as you can see here, has actually torn through that disc material and come out. That jelly-like material has come out of the disc and it's pushing right onto the nerve. And when that happens, more oftentimes when you have the herniated disc, you will get that radiation of pain down into the legs or down into the arms. What we do in our office is we have a disc decompression unit that works really well with people that have radiating pain. When you lay on that disc decompression unit, it creates a vacuuming force that helps to get that disc material to move back into the position that it's meant to be in. It's a pain-free method that it can be very, very comforting. Oftentimes when I get people that come into the office that have radiating pain or intense pain in the neck or the lower back, they'll tell me, gosh, I wish I could just hang my head over the back of the bed, or I wish I could hold on to something and just allow my body to just hang because I want to get that opening up of the area. Well, the disc decompression unit is your saving grace. That's exactly what it does. It takes the pressure off the area. It allows blood to flow into the area, which brings in oxygen, and that oxygen helps to heal. It helps to take the pressure off of the nerve. When we can get the pressure off of the nerve, you will stop getting the radiations down into the arms and down into the legs, and you'll feel much more comfortable. If you're struggling with these issues or you know someone who is, please send them our way. I would be happy to help them. I'm Dr. Jill Westfall with SpinalWorks, and we've got your back.